Good evening. Today, I want to speak with you about something that affects nearly every person over the age of 60. Sleep. Not just falling asleep, but staying asleep and waking up rested. If you're finding it harder to get quality rest, you're not alone. As we age, changes in our body's chemistry, particularly a decline in melatonin, make restful sleep more difficult. As we grow older, our bodies undergo a variety of physiological changes, many of which can significantly impact the quality of our sleep. One of the most important factors influencing sleep in older adults is the natural decline in melatonin production. Melatonin is a hormone primarily secreted by the pineal gland in the brain, and its release is tightly linked to the body's internal clock, or circadian rhythm. This hormone is responsible for signaling to the body that it is time to prepare for rest. In younger individuals, melatonin levels typically begin to rise in the evening, peak during the night, and decrease as morning approaches, helping to maintain a stable and predictable sleep-wake cycle. However, research shows that as we age, the production and secretion of melatonin decrease significantly. This decline is partly due to calcification and reduced function of the pineal gland over time, along with changes in retinal light perception, which affects how the body interprets day and night. With lower levels of melatonin, seniors often experience disruptions in their natural sleep rhythms. This makes it more difficult for them to fall asleep at night and can lead to frequent awakenings, lighter sleep stages, and overall reduced sleep quality. As a result, older adults may feel more fatigued during the day, less mentally alert, and more prone to mood disturbances, such as irritability or even depression. In addition to natural aging processes, environmental and lifestyle factors can further worsen the problem. For example, reduced exposure to natural daylight, which is common among seniors who spend more time indoors, can suppress melatonin production even further. Similarly, the use of digital devices late at night emits blue light that can confuse the brain and delay melatonin release, compounding the difficulty of initiating and maintaining sleep. Moreover, certain medications commonly prescribed to older adults, such as beta blockers or antidepressants, can also interfere with melatonin synthesis, unintentionally worsening sleep disturbances. The implications of chronic melatonin deficiency in seniors extend beyond sleep. Poor sleep has been linked to a range of health problems including weakened immune function, impaired memory and cognitive decline, increased risk of falls, and higher likelihood of developing chronic conditions like hypertension and diabetes. For this reason, recognizing and addressing the underlying hormonal imbalance becomes essential in promoting healthy aging and well-being. Supplementing with low doses of melatonin has been shown in multiple studies to be effective in helping older adults regulate their sleep-wake cycles more naturally. Because melatonin is non-habit forming and mimics the body's own chemistry, it is often well tolerated when used appropriately and under guidance. Timing, dosage, and consistency are crucial to mimic the natural rhythm of the body and avoid overstimulation or grogginess the next day. When combined with lifestyle strategies that support circadian health, such as regular exposure to morning sunlight and reducing screen time at night, melatonin supplementation can offer real benefits in restoring restful, rejuvenating sleep for seniors. Magnesium is an essential mineral that plays a critical role in many of the body's physiological functions, particularly those related to the nervous and muscular systems. In older adults, magnesium deficiency is increasingly common due to factors such as decreased dietary intake, reduced absorption efficiency in the gut, and the use of certain medications like diuretics and proton pump inhibitors, which can lead to increased magnesium excretion. This deficiency can have a significant impact on overall health, but one of the most commonly reported effects is its influence on sleep quality and muscle function. As we age, the body's natural ability to maintain adequate levels of magnesium diminishes, often silently, until symptoms such as fatigue, muscle cramps, and sleep disturbances begin to surface. Magnesium contributes to the regulation of neurotransmitters, which are the chemical messengers in the brain that send signals throughout the nervous system. One such neurotransmitter, gamma-aminobutyric acid, GABA, has a calming effect on the brain and is essential for promoting deep, restorative sleep. Magnesium supports the function of GABA receptors, helping to quiet nerve activity and reduce feelings of anxiety or overstimulation that can make it difficult to fall or stay asleep. Another key role magnesium plays is in muscle relaxation. It acts as a natural calcium blocker, helping muscles to relax after contraction. When magnesium levels are low, calcium can flood muscle cells and remain there, leading to persistent tension and cramping, especially in the legs, a common complaint among older adults at night. These nocturnal leg cramps or restless leg sensations can significantly disrupt sleep and decrease sleep efficiency. Many seniors describe being woken up by sudden, painful spasms that can take several minutes to subside, only to find it difficult to fall asleep again afterward. This cycle can be both physically and mentally exhausting. Furthermore, magnesium has anti-inflammatory properties and helps regulate the body's stress response system. Chronic stress, which is prevalent in many elderly individuals due to health challenges, loss of independence, or emotional strain, depletes magnesium levels more rapidly. A deficiency, in turn, heightens stress sensitivity, creating a feedback loop that worsens both mental well-being and sleep quality. By replenishing magnesium through dietary sources or supplementation, this loop can be disrupted, leading to more relaxed muscles, a calmer nervous system, and improved sleep architecture. Dietary sources of magnesium such as leafy greens, nuts, seeds, whole grains, and legumes should be encouraged. However, for individuals who find it difficult to meet daily requirements through food alone, magnesium supplements, especially forms like magnesium glycinate or magnesium citrate, are often recommended for their high absorption rates and gentle effects on the digestive system. These supplements are not only easy to incorporate into a nighttime routine, but are also generally well tolerated and do not lead to dependency or sedation like some sleep medications. When taken consistently, they help restore balance in the body's biochemical processes, which is essential for promoting deep, uninterrupted sleep and minimizing nighttime discomfort caused by muscle and nerve irritation. Chamomile has long been recognized as one of nature's most soothing herbs, cherished across cultures for its calming effects on both the body and mind. Especially in older adults, where anxiety, restlessness, and trouble falling asleep are common issues, chamomile serves as a gentle, non-invasive aid to promote relaxation and improve overall sleep quality. Unlike pharmaceutical sedatives that may induce sleep through forceful chemical mechanisms, chamomile works subtly, helping to encourage the body's natural transition into rest. The primary compound responsible for chamomile's sedative and anxiolytic properties is apigenin, a bioflavonoid that binds to certain receptors in the brain, particularly those associated with reducing anxiety and promoting sleepiness. This interaction mimics the action of anti-anxiety medications but does so without creating dependency or disrupting the body's sleep architecture. For seniors who may be especially sensitive to medications or who are already taking multiple prescriptions, chamomile offers a safe, plant-based alternative that supports rest without adverse side effects. One of the key advantages of chamomile is how easily it can be incorporated into a bedtime routine. A warm cup of chamomile tea in the evening not only delivers the therapeutic compounds directly, but also serves as a sensory ritual that signals the body to start winding down. The warmth of the tea, the soothing aroma, and the act of slowing down to sip it all work together to create an environment conducive to rest. This ritual can be particularly helpful for seniors who struggle with racing thoughts or emotional tension before bedtime, gently guiding the mind into a more peaceful state. Chamomile's calming effects extend beyond sleep. Studies have shown that regular consumption can reduce symptoms of generalized anxiety disorder and mild depression, both of which are frequently underdiagnosed in older populations. Emotional stress, even if not expressed outwardly, can significantly impact sleep latency and quality. By easing mental strain, chamomile not only promotes longer sleep but also improves its depth and continuity. This is especially beneficial for those who often wake up multiple times during the night or experience non-restorative sleep. In addition to tea, chamomile is also available in other forms such as tinctures, capsules, and essential oils. These offer flexibility for individuals who may not enjoy tea or have specific health considerations. For example, a few drops of chamomile essential oil in a diffuser can fill a room with its calming aroma, while a standardized capsule can provide a more measured dose of active compounds for those seeking a stronger effect. Regardless of form, chamomile remains one of the gentlest and most well-tolerated options for promoting mental and physical relaxation. Because it is naturally caffeine-free and has been used safely for centuries, chamomile is considered low risk for most people. However, as with any herb, it's important to be mindful of possible allergies, especially for individuals sensitive to plants in the daisy family. When used thoughtfully and consistently, chamomile can be a powerful ally in the quest for better sleep, offering seniors a reliable, natural solution to calm the mind and prepare the body for rest. Prescription sleep aids, while sometimes necessary in acute or severe cases, often come with a range of concerns that are especially significant for older adults. These medications, including benzodiazepines and non-benzodiazepine hypnotics, work by suppressing activity in the central nervous system. While they can be effective in initiating sleep, they tend to alter the brain's natural sleep cycles and may lead to long-term dependence, tolerance, and even rebound insomnia when discontinued. For seniors, whose bodies metabolize medications more slowly, the effects can be prolonged into the daytime, resulting in grogginess, dizziness, confusion, and impaired balance, factors that greatly increase the risk of falls, injuries, and cognitive decline. Another key concern with long-term use of prescription sleep medications is the potential for diminished mental alertness and memory. Studies have shown that older adults who rely on these medications over time may experience greater levels of daytime fatigue, poor concentration, and slower reaction times. This can affect their ability to safely carry out daily tasks such as driving, cooking, or navigating stairs. In some cases, regular use of sedative hypnotics has also been linked to increased risk of developing dementia-like symptoms, especially when used without medical supervision. In contrast, natural sleep aids offer a gentler approach that works with the body's own rhythms instead of overriding them. These alternatives, such as melatonin, magnesium, chamomile, and valerian root, are generally non-habit forming and support the body's sleep processes in a way that preserves the integrity of sleep architecture. Rather than forcing unconsciousness, they promote relaxation, reduce anxiety, and help signal to the brain that it's time for rest. This distinction is important, because quality sleep isn't just about the number of hours one spends in bed, it's about cycling through the various stages of sleep in a way that allows the body and brain to repair, recharge, and reset. For seniors, who are often more vulnerable to side effects due to age-related changes in liver and kidney function, natural remedies present a safer option. They are less likely to interfere with medications for chronic conditions like hypertension, diabetes, or heart disease. Moreover, because they don't impair cognitive or motor functions, the likelihood of nighttime accidents or confusion is greatly reduced. This makes them particularly beneficial for those who live independently or want to maintain an active lifestyle without being slowed down by lingering sedative effects. The appeal of natural sleep aids also lies in their ability to be part of a larger wellness strategy. Instead of masking symptoms, they often encourage lifestyle changes that support sustainable sleep habits, such as establishing a consistent bedtime, avoiding screens at night, engaging in light exercise during the day, and creating a calm evening environment. These small shifts, when combined with natural sleep support, often lead to lasting improvements without the physical and psychological toll of pharmaceutical dependency. Choosing natural alternatives empowers individuals to take control of their sleep health in a thoughtful and proactive way. For seniors, this means embracing tools that work in harmony with their bodies, enhancing rest without sacrificing alertness, safety, or long-term well-being. While natural sleep aids like melatonin, magnesium, and chamomile can be helpful, their effectiveness is significantly enhanced when paired with healthy sleep habits and a supportive environment. This concept, known as sleep hygiene, refers to the practices and conditions that contribute to quality rest. For seniors, whose sleep patterns often shift due to age-related changes in circadian rhythm, creating a stable and calming sleep environment becomes just as important as the remedies they use. Sleep aids are most beneficial when they are part of a holistic approach that encourages the body's natural readiness for rest, rather than a quick fix for occasional insomnia. A crucial element in promoting better sleep is maintaining a consistent sleep schedule. Going to bed and waking up at the same time each day helps reinforce the body's internal clock, known as the circadian rhythm. This rhythm regulates the release of hormones like melatonin and cortisol, which play vital roles in the sleep-wake cycle. Inconsistent bedtimes can disrupt this balance and make it harder to fall asleep or stay asleep. When natural aids are introduced alongside regular sleep hours, their impact is more predictable and beneficial. The environment in which one sleeps also plays a major role. A cool, quiet, and dark room helps signal to the brain that it's time to wind down. As people age, they often become more sensitive to changes in temperature and noise, making it even more important to optimize the bedroom for comfort. Keeping the room slightly cool, between 60 to 67 degrees Fahrenheit, is ideal for promoting deeper sleep. This temperature range helps lower the body's core temperature, which naturally drops as we fall asleep. Adding soft lighting or blackout curtains can minimize disturbances, while a white noise machine or calming sounds can help block out unwanted noise. Another major disruptor of sleep is exposure to blue light, especially from screens like smartphones, tablets, or televisions. Blue light interferes with the body's natural melatonin production and confuses the brain into thinking it's still daytime. For seniors who may already struggle with reduced melatonin levels, this exposure can delay sleep onset and reduce overall sleep quality. Avoiding screen time at least 1 hour before bed, or using blue light filters, is a simple yet powerful way to improve the effects of any natural sleep remedy. Equally important is developing a nightly wind-down routine. Engaging in calming activities before bed, such as reading a physical book, gentle stretching, listening to soft music, or drinking a warm caffeine-free beverage like chamomile tea, helps signal to the nervous system that it's time to slow down. This transition phase between wakefulness and sleep is essential, especially for older adults who may find it difficult to shut off after a mentally or emotionally active day. A routine, when repeated consistently, conditions the mind to associate these activities with rest, making sleep come more naturally over time. Sleep aids alone cannot solve sleep problems if the lifestyle surrounding bedtime is chaotic or overstimulating. Natural remedies work best as part of a comprehensive strategy that supports the body's innate ability to rest. A thoughtful environment and routine not only complement the effects of these aids, but also create a long-term foundation for healthier, more restful sleep. While natural remedies are often perceived as safe and gentle alternatives to pharmaceuticals, it is important to recognize that natural does not always mean risk-free, especially for seniors who are more likely to be taking multiple medications for chronic conditions. The potential for herb-drug interactions is a real and growing concern in aging populations. As natural supplements and herbal remedies become increasingly popular for managing sleep, anxiety, and other age-related symptoms, understanding how they interact with prescribed drugs is essential to ensure both safety and effectiveness. Seniors often have complex medication regimens, including drugs for hypertension, diabetes, heart disease, depression, and arthritis. Many of these medications are metabolized by the liver using specific enzymes, particularly those in the cytochrome P450 family. Certain herbs and natural compounds can inhibit or enhance the activity of these enzymes, altering the way prescription medications are broken down and absorbed in the body. This can lead to either an increase in drug levels, raising the risk of toxicity, or a decrease in effectiveness, making the treatment less beneficial. For example, while melatonin is widely used and generally safe, it can interact with blood thinners like warfarin, potentially increasing the risk of bleeding. Similarly, valerian root, another common natural sleep aid, can amplify the sedative effects of medications like benzodiazepines, antidepressants, or antipsychotics, leading to excessive drowsiness, confusion, or impaired coordination. Even chamomile, often viewed as one of the safest herbal remedies, may interact with anticoagulants and antiplatelet drugs, as it contains natural compounds that can thin the blood. Magnesium, while helpful for muscle relaxation and sleep, can interfere with certain antibiotics and medications used to treat osteoporosis, reducing their absorption and efficacy. These interactions are not always obvious or immediate. Sometimes they manifest subtly over time as changes in mood, energy levels, blood pressure, or digestive function. Seniors, especially those managing multiple conditions, may not easily recognize the source of these changes, attributing them instead to aging or disease progression. This underscores the importance of vigilance and open communication when introducing any new supplement or natural remedy, no matter how harmless it may seem. Healthcare providers should always be informed about all substances being used, including over-the-counter supplements, teas, tinctures, and essential oils. This allows for a more accurate assessment of potential interactions and better personalized advice. Pharmacists can also play a critical role in identifying interactions and providing guidance on safe combinations. In addition to professional guidance, seniors should be encouraged to use high-quality, standardized supplements from reputable sources. Herbal products can vary widely in potency, purity, and ingredient lists, and poor manufacturing practices increase the risk of contamination or misleading labeling. Reading labels carefully and avoiding products with vague or exaggerated claims can help prevent unnecessary risks. While natural sleep aids can be beneficial when used wisely, understanding their interactions with medications is crucial for safety. Being proactive, informed, and cautious ensures that these remedies can be used effectively as part of a broader approach to wellness, rather than becoming an unintentional source of harm.